Aeromonas is a gram-negative bacteria which is very common in aquaculture species. It can be found either in cold water species like carp and koi, or in tropical fish in warm water species like tilapia. In the case of carp or koi, the Aeromonas, which in this case create ulcers, is usually identified as Aeromonas salmonicida. Sometimes different species like Aeromonas hydrophila can be found as well. And the ulcers can be by a minimum size of 1 millimeter or can be big size of at about 10 millimeter. The infection can be so severe that it is impossible to sell the fish, either as an edible fish like carp or as ornamental fish like koi or goldfish. In the case of tilapia, there are no ulcers. The infection is all over the body. It can be in the intestine, it can be in the liver, it can be in other internal organs. So it cannot be identified by external examination, and it requires an additional detection by microbiology. In order to identify the problem, we need to take the internal organs from a sick fish. It is very important to take it from a moribund, symptomatic or sick fish which is showing the disease in a very clear way. This will help us to get the right results. So we take the relevant organs that we suspect to carry the bacteria and we isolate it, we seed it in an agar plate, and then we will see or we will not see the growth of the Aeromonas on the plate. After we identify the bacteria, we still need to continue to investigate our problem. Maybe the source of the problem can be poor water quality, high pH, high levels of ammonia or low oxygen. In the case of Aeromonas salmonicida for carp and koi, it can be related directly to transportation, to handling, usually heavy handling or sorting of fish, can be carp or either koi or goldfish. So we will find ulcers, we will find Aeromonas salmonicida in fish that were transferred to other ponds and were handled usually aggressively. Treatment of sick fish can be done either by adding the medicine to the feed or by injection by using the right medicine. In any case, a sensitivity test must be done in order to identify exactly what antibiotics we are going to use. This procedure should be done every time when we have an outbreak, and we want to do it before we do the medical feeding or the injection of the antibiotics. By doing a sensitivity test and by recognizing exactly what antibiotics we are going to do, we are treating it in a responsible way and we're preventing future outbreaks.